Good afternoon. My name is Jeffrey Curl. I'm a caseworker with the City of Charleston. I'm here today to speak on a particular case that I've been assigned to work with a patient named Andy. Andy is a 12-year-old boy who has difficulty communicating effectively and organizing his ideas. Um, this has led to challenges in the academic and social aspects of Andy's life. Andy has performed well academically on multiple choice style tests, but the written assignment and verbal delivery of information in the classroom settings have been challenged. Andy is involved in after school activities and maintains social relationships, but his struggle with maintaining focus and organizing his thoughts have begun to impact his academic and social experience. Andy has no past medical history and a past preschool physical exam found no underlying medical conditions. The lack of ability to organize his thoughts when writing and the difficulty with oral presentation led me to believe that Andy is suffering from attention deficit and hyperactivity disorder with predominantly inattentive presentation. As stated by Nichols, a specifier does not represent a different diagnosis. It's an extension added to a diagnosis, which is to say that Andy's inattentive presentation is the manifestation of the overall diagnosed ADHD. Andy has not shown any indicators of hyperactivity and believes and behavioral issues have not been identified by his parents or teachers. The issue that have been identified seem to stem specifically from difficulties associated with written and verbal communication and the organization of thoughts in the act of communicating. As stated by Roth, people who have inattentive types are typically less disruptive and active than those who are predominantly hyperactive impulse type, which is consistent with Andy's presentation. To come to a firm diagnosis, Andy has undergone another medical evaluation specifically to detect any underlying causes to ensure that the symptoms are there and that they are not caused by another medically explained condition. It's also important to determine that the symptoms have not been caused by any other outside stress factors and to identify if Andy has any coexisting mental health conditions like depression, anxiety, or bipolar disorder. A detailed history report about current and past behaviors and interviews with family members indicate that Andy's symptoms exist in multiple settings. Andy's symptoms include difficulty focusing on tasks, avoidance of tasks that require long durations of focused thought, appearance of inattentiveness when being spoken to, difficulty organizing his own thoughts, difficulty maintaining friendships, and difficulty communicating his own thoughts. It's also noted that the symptoms Andy's experienced have increased in severity the older he gets. Treatment for Andy will be a combination of medication and behavioral therapy. Andy will be prescribed Ritalin, which is a psychostimulant medication. Andy will start on the lowest recommended dose, and after being on the medication treatment, Andy will be evaluated every 4 weeks to determine the effectiveness of the medication and any changes needed in dosage. Andy's also been prescribed cognitive behavioral therapy with the intent on implementing strategies to help him control his thoughts. Cognitive behavioral therapy will allow for Andy to learn how to focus and organize his thoughts through modifying his thought pattern and identifying the behaviors that contribute to Andy's condition and modifying those behaviors. Bi-weekly cognitive behavioral therapy sessions also allow for Andy's progress to be documented to determine the effectiveness of the treatments. Hopefully, with the combination of cognitive behavioral therapy and medication, Andy will soon be able to communicate his thoughts both verbally and in a written format and be able to thrive in both the academic and social settings. Thank you for your time. Have a good afternoon.